Hello, I'm going to explain to you the difference between public health policy and individual food behaviors. So a lot of times when you're speaking in the health space, people say, I want to increase my water intake, or I want to eat more protein, which are all wonderful behaviors. And we live in a society, I live in Southern California in the United States, where we have access to safe water. So we can say individual behaviors because we have this level of safety. When you're looking at the public health, you have to remember there are different types of access. There's different socioeconomic classes which are going to dictate what they have access to. So when you make a policy, you want to make sure that it can be fair for all of the people involved. So when you're having big, large conversations about public health behaviors, and you say something like, our food is poison, we're poisoning the food supply. Poison is a really strong word. Toxic poisons in terms of food would be listeria or the Ebola virus, something that could legit cause GI distress, which could cause fatalities. So you want your food and your water supply to not have those things, which we do well in the States. The next level of concern are the additives and the food colorings and the 70% of our ultra-processed foods. Are they affecting our health? That is the next step in research. Individually, if you want to remove things like high fructose corn syrup or maltodextrin from your foods, you have the ability to do that. Do we have access to those foods as wildly that compared to access of foods that have those things? 7 out of 10 foods are going to be ultra processed in the United States. So I think conversations to shift that can happen without calling food poison or toxic. That type of language in a large public health conversation creates a lot of fear, creates a lot of not safe feelings. And then when someone is feeling unsafe, they're going to act to feel safe. Our brain wants to feel safe at all times. It really tries to avoid change. And so when you're listening to leaders and they start using really charged language that makes you feel unsafe, pay attention to that, because that type of fear can move people to behave, but it's not long lasting. It's not transformative. It's going to be a short-term motivation that doesn't work long-term. So hopefully you can kind of understand when you're listening to your practitioners or you're listening to public health leaders, you want them to be using language that is long-term and looks at the large majority of the population. Hope this helps.